My journey is also quite interesting, and it might be quite similar to people who work in NTDs, or at least a good 10 years out of these 15, I worked in all those different things other than NTDs. So I've been working in NTDs for the last about 6 years. And like I said, when I speak with other people who work in NTDs, the answer I usually get is, how did you get into NTDs, is by accident. And the same thing happened to me. I happened to chance on Effect Hope, and they said, yeah, you've worked in Liberia, you worked in East Africa, you worked in Asia. NTDs are in all these places, and so you come and work with us.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
So we talked about what neglected tropical diseases were, its burdens, its causes, and its geographical distribution. But now I want to get into some of the work being done in the global NTD space. So we're fortunate here to have two interesting perspectives, one having a more academic and research background and the other having experience from the NGO side of neglected tropical diseases. And I know that means the best place to first start is by finding out how each of you got interested in neglected tropical diseases. So Alison, you received your Master's of Science in Public Health and your PhD from the London School of Hygiene and Tropical Medicine, so it's clear that you've had some interest in public health. But how specifically did you find your way into working with NTDs?
So it's a great question. I was a HIV/AIDS person. That was the kind of I was a Peace Corps volunteer. Worked for the National AIDS Program in Gabon. And then worked with Médecins Sans Frontières in an HIV/AIDS program, and was doing a lot of health promotion and trying to get people to change their behavior. And there was a German government program that was working on lymphatic filariasis in eastern Indonesia. And my colleague said, well, why don't you come over and do lymphatic filariasis? And I said, I don't even know what that is. I said, I'm HIV/AIDS. That's what I know. And he said, no. It's all the same theory. You just learn a new disease. And that was in, I don't even know now, 2003. And so I switched over and never went back. So I touch, you touch into that field a little bit here and there. It's moved on really a lot in 20 years. So yeah, it was just kind of shifting gears, same theory, but different disease.
Very interesting how one person can be so influential to your career path.
Yeah, for sure.
So Maneesh, for more than 15 years, you focus on a variety of issues, affecting child and maternal health. But what made you focus specifically on NTDs?
My journey is also quite interesting, and it might be quite similar to people who work in NTDs, or at least a good 10 years out of these 15, I worked in all those different things other than NTDs. So I've been working in NTDs for the last about 6 years. And like I said, when I speak with other people who work in NTDs, the answer I usually get is, how did you get into NTDs, is by accident. And the same thing happened to me. I happened to chance on Effect Hope, and they said, yeah, you've worked in Liberia, you worked in East Africa, you worked in Asia. NTDs are in all these places, and so you come and work with us. So that's how I started, and yes, I was, I am originally from India, and I've seen these entities like lymphatic filariasis and leprosy firsthand. Of course, STH, we all get it when we are, growing children, and I never thought that I would work in this specific area of NTDs, but here I am.
It's funny how accidents can lead you to something that's so influential and it helps you make a big impact.
Yeah.
Discovering your passion by accident.
Yeah.
Or being very opportunistic when you're young and somebody offers you a job, you say, okay, I'll try lymphatic filariasis. I don't know.
True.
Awesome. So yeah, thanks for sharing a bit about your backgrounds and how you got into your NTD work. But if you could expand and talk a bit about currently what you're doing to tackle neglected tropical diseases. And I know Alison, I work with Alison. She's an investigator at Brier's Research Institute and the chair of the steering committee for CNNTD. What kind of work are you currently involved in, Alison?
Great question. I guess I'll highlight two things that I'm really interested in right now from a research perspective. I'll say three, but I'll be fast. One is around this whole issue of non-adherence, Gordon, that you raised, and I'll be quick. Particularly as we reach the last mile for a lot of these programs, where we're really trying to find the people we've missed, is really to understand who are those people, and they're really issues around equity. Who are we consistently missing in our programs, and why? Why are we missing them, and how do we tweak and fix our programs so that we make sure we get those migrant workers, nomadic people, women, certain men, fishermen, men in general for lymphadenophylloriasis, we have a challenge. So kind of finding those missed populations and addressing that. The second thing I'm really interested in right now is the female genital schistosomiasis, and really trying to demonstrate a holistic way of looking at this. So we have a project that's funded through Grand Challenges Canada with partners in Madagascar and Ghana to look at this from a holistic approach. Also partners in the U.S. So that's exciting, and I look forward to kind of seeing how that's going to contribute to our dialogue on this condition. And then lastly, I'm just interested in the volunteers, the people that are delivering the drugs, and how do we support them better, and how do we ensure that they can carry out their work in a way. These people serve their communities day in, day out at great cost to themselves, and I think we can do better in how we support them. And a lot of these volunteers are being pulled into COVID-19 activities, and so we have a project right now funded through Ascend to look at how to improve well-being and resilience amongst these volunteers.
Wow, it seems like the theme I'm getting from these different passions and areas of your expertise is you go to the places that are often ignored. For example, uptake of medication. I can easily see people in the past, for example, saying, oh, well, people aren't taking it, it's fine. We'll just target the people who are. But you want to know, why are they being missed? And, you've been focusing on FGS that you mentioned is often ignored, and the volunteers. So you have like a passion for the underdog, to find those people who are missed. I like that.
Social and behavioral sciences.
Yes, the equity piece. So thank you for sharing. So Maneesh, you had mentioned Affect Hope, and you are currently the director of international programs. And I was hoping you could speak a little bit more about Affect Hope as an organization, and also your role within the broader context of NTDs.
Thank you, Linda. At Affect Hope, we have been dedicated to this mission to combat NTDs for over 125 years. It's an old organization, and we are currently investing in programs that try to make a positive impact in lives of people affected by NTDs. We are working with our partners in both Africa and Asia, and we try, as I said before, we work with diseases that require case management or intensify disease management, like leprosy, lymphatic filariasis, among others, and also try to tackle some of the consequences that they cause, like disability, stigma, mental health issues, and even poverty. So that's what we try to do at Affect Hope.
Yeah, thanks for sharing. I think it's good to find out the particulars of your organization's work, as well as the focus of your specific work within the organization. So I want to bring it even higher level than that and talk about from the global context. So since 2010, significant progress has been made in terms of NTDs. And as of today, I believe 600 million people no longer require interventions against several NTDs, which is a good thing. And the latest numbers suggest that 42 countries, territories, or areas have eliminated at least one NTD. So in your line of, bring it back down to your line of work, are there any success stories that stand out for each of you related to NTDs that you can speak to? Any kind of personal, organizational milestones that you'll be able to share?
I think one of the most exciting things that I've been part of was the acceptability work component, that study that I did for a new drug regimen for lymphatic filariasis. So there are 3 drugs that are used for mass drug administration for lymphatic filariasis, but they hadn't been used together, the 3 of them. And so it had been sort of posited over the years, well, gee, what if? And there was a clinical trial that was done that showed in a small number of patients that it was like unbelievable the way that it reduced microfilaria, or kind of the baby worms of lymphatic filariasis. And so under Gary Weil at Washington University in St. Louis, he led, with Chris King in Case Western Reserve University, they led a large study across 5 countries to look at the safety and efficacy of these 3 drugs. And I kind of came along to say, well, what about the acceptability of these 3 treatments? You know, now we're giving people more pills. Are they going to have more adverse events? And it was a tremendous experience. It was funded by the Gates Foundation. And it was a roller coaster of about a year of just intense work, traveling all the time, setting things up. And we basically went from the first treatment given during the safety and efficacy trial. Within a year of that trial started, we were having a guidelines meeting at WHO to shift to see if we can use triple drug treatment for lymphatic filariasis. And then within a couple weeks of that decision at WHO, Merck announced a drug donation to support the rollout of IDA in countries that were eligible to use it. So I don't think in my career, again, I will experience that incredible kind of rush of going from evidence to global policy to drug donation, within a period of about 14, 15 months. It was just extraordinary. And the global collaboration was also just extraordinary. So I'm very proud to have been part of that team, and we continue to roll that out and support countries that are introducing that new treatment. So that's probably a highlight for forever for my career.
That sounds awesome, Alison. I've not been that lucky to have something so specific as a highlight. But over the last 5-6 years that I've been working in NTDs, one of the successes that I'm really proud of, that we've been able to be part of, is strengthening NTD services within some health systems. Particularly, I would mention Liberia, part of Nigeria, because it's a much bigger problem. They say Nigeria gives a birth to Liberia every year because of the population size. So we've done little bits in Liberia, or big bits in Liberia, small bits in Nigeria, and then also in India and Bangladesh, where what we did was focused our work to really first target improvement of the policy within the country. Like I mentioned before, bringing together some of the synergies in these diseases that are called case management entities, and bring them under one umbrella within the NTD framework, and then do things like training of health workers, facilitation of tools and mechanisms for referrals all the way from the community to the primary care centers, and through awareness and education and building partnership within NTD affected people as well, and their organizations. Thereby what we did was, while we strengthened the services on the supply side of the health system, we also ensure that the communities know that they can demand for these services, that these are rights that they should have, and thereby trying to improve health in general.
Thanks for sharing some of your career highlights, if you will, and success stories. I think we can definitely draw some inspiration from those. But sometimes we forget the challenges in our work because of the difficulties and those kind of maybe painful memories. But there are definitely lessons to be learned when things don't go quite the way we planned. So if you could also speak to some of those challenges each of you faced in your line of work and the lessons that you learned and took away from it.
Oh, Gordon, you've stumped us. Yeah.
You've never had challenges ever?
No. What comes to mind? I early days. So this was like almost 20 years ago. When I went to work for the German government, and I was in this little town in Alor. Alor is a district in eastern Indonesia. Like I used to say, you go to the end of the earth and then you kind of go past the end of the earth a little bit further. Beautiful, beautiful part of the world. And we were doing a pilot project to do a mass drug administration for lymphatic filariasis because we wanted to demonstrate to the government of Indonesia that this was a viable option for Indonesia. And I went to the village leader's house, and in Indonesia you have to eat. You go to the house and you have to eat. And I learned quickly that you have to have seconds, right? Because if you only have one thing, it's not enough. So they always say, "Mau tambah." It's like, do you want more? And you always have to say, "Oh yeah, I'll have more." And you have to add 2 or 3 times. So you always take a little bit of rice because you have to have at least 2 more servings of rice. And so I had eaten in this gentleman's house, with his family, and they do this big thing, and he was a partner. And then we got in the car and we were going to go back, and he said, no, you have to go to my other house and have a meal there. And I said, thank you very much, but we've just eaten very well, and we should, get going. And he was angry with me. And he said, well, if you don't want to eat in my house, then you don't work in my village. So we go, yes, of course, would be delighted to, eat again eat, and that's absolutely fine. And, I just learned that these things are so important, and you have to kind of put aside your own, assumptions about, where you come from, and accepting that hospitality, which I thought I had done,
right?
But I hadn't done it, to the extent that it needed to be done. And it really just kind of reminded me that those little things make a huge difference and can make a huge difference in the success of your program. And it goes back, Linda, to what you said about building trust. And trust, it's things like eating in someone's house builds trust.
Yeah, I think I have many similar stories to tell as well. Just to speak a little more broadly of challenges, I think in all our work in strengthening health systems or strengthening NTD services within health systems, where you are trying to improve policy, trying to provide your inputs and your advice towards the improvement of policy. There is that whole element of building the trust with your partners, with your NGO partners in the countries, with the government counterparts there, with policymakers, and it's a slow building of relationship over a period of time is when you will actually see the results in the end. So we've had really good partnerships in countries like Liberia and Bangladesh and parts of India, but it has taken a long time to build that trust. And sometimes you see, even if there are people who are willing to do that, there is this huge challenge of not having a political commitment within the system to do it, because we know the NTDs, why they're neglected is because they're neglected within their own health systems. They are not given the finances to improve. They're not given the attention, because again, like we said in the beginning, these are not diseases that are really killing people. But over time, I think by building good relationships, we are able to overcome these challenges. But it takes a long time.
Sounds like you guys are, both of you are relationship building experts from all of your experience.
It's going to be interesting to see how COVID-19, you can't go to the field, and that's where you build a lot of these relationships. So, Zoom is not a good substitute for having a meal together or meeting face to face or drinking tea together or whatever. So, we'll see how that challenge brings a greater challenge into that relationship building.
Such an interesting point.
Yeah, I'm already feeling that, having been away from the field for a whole year almost, not having, face-to-face meeting with some of the people in the government, especially, you're able to speak to, your NGO partners. But I think it will definitely have an impact on some of our work.
So, January 30th is World NTD Day, and this is a great opportunity to raise awareness of some of the work that's happening in global health. And I know Public Health Insight is doing this podcast to raise awareness, and they're also working on a NTD flip book. So can you two share a bit about what that day is about, and share a bit about the 2021-2030 NTD roadmap as well, and maybe how those two things align?
So we're really excited. It's the second annual World NTD Day. The last one we had last year was the first time we've done it. And it's an opportunity to raise awareness about neglected tropical diseases, and also to raise awareness within the community and also externally with people who don't know about these diseases and why they're so important. And there's a really terrific video right now on the Uniting to Combat website, which I would encourage people to go look at, which talks about making the unseen seen, and really taking these neglected conditions and raising their profile so that people are aware of them. And, particularly right now we're very focused on COVID-19, but we don't want to lose the gains that have been made. And we also don't want to forget people who continue to be exposed to these diseases. And so it's really an opportunity to highlight and to really galvanize action towards the next decade of action. So the WHO NTD roadmap is being launched on the 28th of January, and so we're really excited about that and how we can support the goals that are laid out in the roadmap to bring us forward towards achieving the SDGs, which include neglected tropical diseases as one of their goals.
Yeah, I would just add from our discussion on the challenges, and where I mentioned political commitment is one of the huge challenges that we see at the national level, at the global level. And so this celebration of the World NTD Day is really to push that that ball forward, where we, along with so many strategies that we have in addressing the diseases themselves, we also need to do a huge amount of advocacy for the people who are affected by these diseases. There needs to be a holistic approach that is being provided now with the new 2030 roadmap, and so it needs to be hand in hand with some of these advocacy approaches for this grand challenge of NTDs that is affecting 1.7 billion people.
And even those of us here in Canada, we could write to our MPs and ask them, are you going to acknowledge World NTD Day? I think sometimes we forget, if we're not, in a target area, we can't do anything, but we can do a lot of advocacy from Canada.
Absolutely. And I think, Linda, one of the things that we've been saying for years within the Canadian network is NTDs are the missing piece. So, Canada's had a real focus towards maternal child health, women and girls health. They haven't specifically focused on NTDs, but by ignoring them, it's kind of like this hole. You can take care of a woman's, make sure she has a healthy pregnancy, but if you don't deal with deworming, you can't do that. Or a child is born and grows up in an environment where they're infected by worms. You can't expect them to do as well in school, for example. And so we've really seen NTDs as a missing piece. And so I think Canada needs to be, they are engaged and need to be engaged more, because we're leaving a gap in our efforts if we don't address NTDs. And tools are there. The treatments are donated. There's a whole, there's a huge community that's working together. So I always say the party's started. Come and join the party to get rid of these ancient diseases.
And just to add to that, with a small investment in NTDs, Canada's huge investment in MNCH and SRHR can be multifold by this little investment in NTDs. So it is really the missing gap in our Canadian support to global health.
Yeah, and I'm glad you both mentioned it, because by addressing these diseases, like you mentioned, there's consequences. Mothers aren't able to provide to their children. Children get sick and are not able to attend school. If you don't get an education, you're not able to get a higher paying job, regardless of what context you live in. And then that kind of perpetuates that vicious cycle of poverty. So there's a lot of consequences and a lot of positive kind of downstream effects and upstream effects that we can get by addressing NTDs, for sure.
Yeah, some of the best studies, we had one that was done in Indonesia years ago around the household expenditure for lymphatic filariasis. And when you present that to a government official in the country where you're working, it's astounding. And they say, wait a minute, I have a free treatment to get rid of this. All I need to do is to put a little bit of effort towards delivering this drug for a period of time, because it's not for forever, and we can get rid of this. And it's an easy sell. When you have the right information at your fingertips. So you're absolutely right, Gordon. The downstream impacts of getting rid of these diseases are fantastic.
Yeah, I mean, the conversation most definitely doesn't end here. You both mentioned all the great work that has happened and is currently ongoing. So what has to be done next? What types of supports are required to make sure that we can reduce the burden of NTDs? And what are some practical things listeners or anyone who's interested in neglected tropical diseases can do?
Watch the CN Tower on January 30th, because it's going to turn orange, and get on social media and be active. Visit our website at the Canadian Network for NTDs with lots of messages, ways to get involved. Depending if you're a student and young professional, every year we have an ambassador program that happens. So, keep an eye out for that. There's a global youth movement for NTDs that's being coordinated from Uniting to Combat, which is really exciting, and kind of looking at how to get young people involved in this space. Write your MP, for sure, Linda. This is important. Canada needs a comprehensive global health strategy. They need a framework to galvanize the great work that Canadians are doing. So I think the public needs to be aware about this. They need to be aware that leprosy is a biblical disease that still exists today, that we can get rid of. And this is a human right for people, and we can do it. So I think it'd be great to hear the voices of Canadians on this.
In general, we just need to raise a little bit more awareness. Why these diseases are called neglected is because we neglect them. And it is not just the policymakers, it's not just the donors, it's not just the endemic countries, but all of us are in this together. We all have a role to play, and the more we talk about it, just like what you're doing here on this podcast, spreading awareness on issues that make a huge difference in the lives of people who are affected, is what we need to do. So thank you for doing this, and we have to keep doing more and more so that people are all aware of such diseases, and we can take the appropriate action.
One point to also note is, even in education curriculums, I remember even myself, I knew about tuberculosis as a kid, and then when I went to MPH, I was like, oh, this is still an issue. And then I leave MPH, and then, there's something called NTDs that is even a more hidden issue than tuberculosis itself. So I think even in our education programs that are designed for teaching the future public health and global health leaders, we should probably perhaps do a better job of giving students opportunities to maybe be involved with addressing NTDs. But any final words that are related to NTD, or just, as a takeaway. I'll give you both the opportunity to kind of summarize what's on your mind.
So I would end with somebody that often gets quoted in this space is Dr. Bill Fahey, who was the director of CDC. And he always talks about seeing the faces of the people that we serve. And so we've talked about 1.7 billion, we've talked about a lot of people, we've talked about, and I think what's important is to remember that, why is this important? Because these are people's lives, and Absolutely. We can truly make a difference in people's lives in a way that is extraordinary. And so that's, for me, the big call to action, and that's why not going to the field is so hard, because you become very disconnected from what you're doing, and to remember why you work long hours and why you are passionate about something is because it really is to make a difference in people's lives, and to advocate for people who don't have the voices necessarily to be at the tables where we sit. And we sit at those tables because we're in Canada, to use our voices to make sure that that they can be heard. And there's no reason why we still have leprosy in 2021 or lymphatic filariasis. We can do better, and I think for me, I'd like to see Canada and Canadians take an even greater role in this space.
Yeah, I think Alison put it really well in terms of really making a difference in the lives of people affected. And yes, we would like to see that happen, but how do we make that happen is by all of us taking action on this. We all have the power to do our bit, and that's what we must do. We must do the right thing, do things that improve the lives of these people who are affected. And it's not their fault that they're born in such situations. It is how it is, and we can all make a difference by doing the right thing.
We just heard experiences from Alison and Maneesh, who are working to reduce the burden of NTDs worldwide. We touched on how they began to get involved in the NTD space, success stories, lessons learned, and their thoughts on World NTD Day and the newly released roadmap. Though World NTD Day has just passed on January 30th, much work is left to be done. You can learn more about the NTD initiatives led by the Canadian Network for Neglected Tropical Diseases and Affect Hope by visiting their website, which is linked in our episode description. We hope that we have inspired you to think more deeply about these neglected diseases and become advocates in the fight to end the neglect. My name is LaShawn, your host for this episode. Peace.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.